a baseline for your horse. And in an emergency, knowing their baseline and knowing the difference between a baseline and what they're currently at will help you cater a better care plan. One of the first and easiest vital signs to take, we're going to look at their mucous membranes. There are two places you can look. You can look at their tear duct, but generally we will look at their gums, as it's an easier access point and there can be less damage done in case you incorrectly touch them. So to look at their mucous membranes, we're going to gently lift up their lip. They may make a face or lift their lip for you, but generally you're going to be looking at the color and the sliminess of their membranes. So here he's bright pink and slimy, meaning he's in good health. If their gums were any other color, it would mean there would be a different problem with their health, whether that be red and fiery brick red, that could be fever or inflammation. Yellow could be jaundice or liver problems. If it's too pale, that could be anemia or shock. There's also many others, but just knowing the simple ones helps. Another thing we can check in the mouth is their capillary refill. To do that, we're going to lift up the lip, press our thumb, and then let go. You should see the blood return to the area where you pressed within 1 or 2 seconds. Extended time on the refill of the blood could mean lower blood levels, and that could lead to identification of dehydration.
Wait, no.
The next vital sign we'll be looking at is their pulse rate. We can do this by finding any easily accessible artery or vein. Generally, we're going to be using the maxillary artery. It's going to be right next to their jaw. It's going to feel like a straw. So it may take a little bit to find it, but once you do, you're just going to feel it. You're not going to press too hard to stop blood flow, but just enough that you can feel it pulsing in and out. When you are doing the time, you're going to do a time for 60 seconds. You can either do intervals of 15 and times by 4, or you can do an interval of 30 seconds and times by 2. Generally, you're going to want a helper when you're doing this, but in emergency situations, doing it yourself can also work. Their heart rate should be within 40 and 30. I'm just going to wait a few seconds so it's easier to edit out. Their heart rate should be between 30 beats per minute and 42 beats per minute. Moving down the body, another vital sign that we can look for is our skin palpability test, or a skin pinch. Another vital sign that we can look for is the skin palpability test, or a skin pinch. This is generally going to be a guide for their hydration level. It will differ based on the horse's age, as when horses age, the palpability of their skin does go down. So to do it, you're just going to find the middle of their neck, grab a little bit of skin, hold it for 1 or 2 seconds, and then let go. Ideally, the skin should return to normal within 1 to 2 seconds. If it's more than 1 or 2 seconds, that means they are a little bit dehydrated. Severe cases where it's above 5 seconds can cause signs of severe dehydration. Our next thing we will be doing a vital sign on is our heart rate. This should be within the same numbers of 30 to 42 as our pulse rate, as the heart is linked to the veins and arteries. But sometimes there are going to be differences between their pulse rate and their heart rate, that if there is a difference, that could mean there's internal bleeding, external bleeding, but it is something good to look at. So to do that, you are going to use a stethoscope or other listening tool, put it in your ears, and then this way. You're going to find their heart girth, which is going to be right here, and you're going to find the least meaty section, so right about here, and you're going to press it, and you're listening for a lub-dub sound. And then just like how you would with the pulse rate, you're going to time for either 15 seconds and times by 4 or 30 seconds and times by 2. Next, we will be looking at the respiratory rate. Due to the way horses' anatomy are, you generally do have to stand behind them Make sure you always at least have one hand on them and that they know that you are back here. Try not to surprise them. When you are standing behind them, you're going to be looking for their flank, expanding and detracting. So just like how the others, you're going to time for 60 seconds. Because they do breathe so slow, you are going to want to time for 30 seconds and times by 2. That way you can get an accurate number. Ideally, a horse's baseline should be between 8 breaths per minute to 12. Some horses are going to be slower or faster depending on their size. Next, we will be listening to the horse's gut sounds. There are 4 quadrants of their stomach: upper left, upper right, lower left, and lower right. You should always be listening to all 4 quadrants, as they all could have different vital signs. So you can either use your ear or a stethoscope. I prefer to use a stethoscope as it can give you a more accurate sound. And you're just going to press the head right where that stomach is. You should be listening for not constant sounds, but gurgling sounds coming in waves. If they do have constant sounds, that could be signs of hyperactivity, which could be signs of a type of colic. You should also be listening for a pinging sound, like ping, ping, that is a sign of gas colic. Ideally, there should also be at least some sound. If there is silence or completely no sound at all, which is silence, that would also be a sign of colic. Next, we will be taking the horse's temperature. You can stay right there. Next, we will be taking the horse's temperature. You can either use a mercury thermometer or you can use a digital one. With the digital, they will run a little bit hotter or colder depending on how old it is and who marketed it. So always take multiple temperatures if it is out of normal range. A horse's normal range should be 99.5 to 101.5. Again, some horses may run a little bit hotter, a little bit colder. The outside temperature will also change that. If it is below a certain amount of time, certain temperature and it's cold outside, their bodies will generally run colder. If they just did a lot of work or it's very hot outside, they will be a little bit warmer. When prepping to take a horse's temperature, you should have some type of lube, whether that's petroleum jelly or any other type of lubricant. You should never dip the thermometer into the petroleum jelly or lube, as that could compromise the biosecurity. You should always dip in with your finger and then gently rub on it. And just like with our respiratory, we're going to make sure we are watching the horse's body movements, as because we will be inserting the thermometer, some horses may get a little squirmy or uncomfortable with the matter. Making sure the thermometer is lubed and on, we're going to grab the tail head and bring it towards us. And we're going to keep our elbow on them, that way we can feel their body moving if they do. We're going to gently and politely insert the thermometer and then point it up and over. That way we're touching the rectal wall rather than a trail apple. And then you're going to hold it until it beeps. And then you're going to read the temperature. Sure, you're going to take some either liquid chlorhexidine or some type of alcohol to disinfect the thermometer.